Which is
days
not
when
something.
things would turn off the
All right,
tape.
so this meeting is now being live streamed.
Okay.
And, so this is Senate Appropriations, and we are not working on the budget adjustment right now, but we're getting an opportunity to talk with our new senator from Vermont. So welcome, Senator Welch. What a nice title. That must feel good, huh?
Senators.
They don't even have to remember your name. They just say senator, right?
Yeah, Peter works.
Oh,
It's great to be here, and I mean a couple of things, just on a personal level. It's just wonderful to be back in the Senate. I started years ago, so so much with you in the House with you, and we've got some newcomers here.
Mine wasn't new.
I actually served in the House with Bobby, then in the Senate with you. You were in the House, first in the Senate for so long. Just a couple of things. One is the responsibility that the state legislature has, as you know, is extraordinary. Because with all the COVID money that came in, the big decision we had to make, and Bernie, Patrick, and I were all on this side, was to give maximum flexibility to the states. And we had a lot of confidence that Vermont would make decisions that would be better than what we could make. That's always a tough call in some respects because some states were inclined to try to use it to give tax cuts and essentially lower their obligations instead of use that money to meet immediate pressing needs, but also to make a lot of new investments. So, I just want to say I always speak for Patrick and Bernie. Of course, Becca was here at the time this was happening. But we really feel vindicated by the approach that you've taken. And also, Jay, especially you, all of you, during that COVID time, you had to be doing all this remote without support, and it was just exhausting emotionally, physically. I just want to acknowledge what an incredible job you did. And,
well, it was a lot of money, and it was a wonderful opportunity. And I look back and think about how much of our lives was spent in front of a screen. I remember
Right.
one day, and my lunch was an ice cream sandwich, and
You were lucky.
yeah, all right. And so I look back, we did multiple budgets. We really worked hard to move the money in a responsible way. So it was an opportunity that you gave us. When the governor used the term squander, it kind of gave me I felt kind of flinched a bit because I don't think anything that we have done would ever, fall into squandering. And so we're still, and with the broadband money and the infrastructure bill, there's still more opportunities for us. So
Well, and that's
great.
partly what I wanted to talk about too, because right now, the biggest challenge for us is, in my view, it's implementation. With the Inflation Reduction Act and that's additional money, broadband, there's a lot of money in there for clean energy. A lot of those projects can be locally driven.
Mhm. It's like 26 billion for what, maybe energy, I think, or something. And
Well, for clean
Ireland,
energy,
yeah.
and the IRA was like $500 billion, and it's mainly incentives. But the key here is going to be the implementation. Because you finally had, we're talking now about the climate provisions in the IRA. That's the first time that there has been major legislation about policy initiatives to address climate. And that was a breakthrough. The entire time I've been in Congress, there's been this fight back and forth about whether climate change is real or it's not. My view is that really wasn't a debate. The debate was really a proxy for the apprehension people had about what it means to transition from carbon-based to a clean energy economy. And my view is that was a well-founded apprehension. That is disruptive. I went to a coal mine in West Virginia with one of my Republican colleagues. We went down 900 feet and then 4.5 miles in, and I spent an afternoon with the coal miners when they were cutting a seam of coal. Those folks work hard, and I said to them, we don't have coal mines in Vermont, but we have electricity, and we really appreciate you guys keeping the lights on for so long. And they were worried about how they're gonna pay their bills or way of life. And we have to honor that. And that, I think, is what kind of kept us back. Now, we've got to make that transition. We've got the opportunities to do it. And just to give an example of how there is a real opportunity, you know,
More staff.
There is a new champion for some of the provisions in the IRA, well-known climate activist and eloquent climate change advocate, Marjorie Taylor Greene. And this is a good story.
Glad to hear it.
There is.
Was there an epiphany?
Here's what the epiphany is. With the incentives in the IRA, a Korean company is building a very large solar panel manufacturing facility. Their district is going to be 2,500 really good paying jobs. All right. So that's what's going to make the conversion. It's like real net community, real people showing up doing good work, and where we're showing that we can actually move towards affordable clean energy. And see, I think that the goal of clean energy is important, but it's got to be affordable. We can't be preaching to people that they should go do the right thing if they can't afford the right thing. And what public policy is about is creating that potential so that the market can also get involved and start driving prices down. And we've seen that within solar. But that's why I think this implementation challenge is so important, and that's got to be done at the local level. So, two things. One, any of the projects that make sense in Vermont, and to some extent there will be the feds involved in that. We want to, Rebecca and Ryan, and I want to be hearing from you and doing everything we can to facilitate it. But number two, keep an eye on the rollout. How are we going to make this work? How are we going to get towards the affordability element of clean energy so that the folks in Vermont will challenge, as we are all around, with affordability questions, that's really tough. It's got to be affordable. And that's where the implementation comes into play. So, we want to be involved with you, and there's still that infrastructure money, there's that IRA money. And to some extent, rules and regulations in DC will accelerate or retard the growth to the extent that you're hearing from the folks here. You're closer than I am about some. Yeah, about what some of the impediments are, the problems are. We can be helpful. And, that's where Bernie and Beck and I can weigh in about some rules and regulations and try to get them so that they're appropriate and don't become impediments. So our office wants to be partners with you because the implementation side is just going to be so much more at the local level.
One of the things that has come our way, and I know we've directed communication to your offices, and that's on the broadband and the FCC and the mapping and the inaccuracies in the mapping that gives a much more positive sense of what we have for broadband coverage here. And I just wondered if there's any progress on that front.
Here's where there is progress. This issue of how bogus the maps were was something people were experiencing, but it was this department, the public service department here, that really took the action that made that concrete. And that is when they drove around and did all the mapping. And they were in these districts where it said it was like 90% penetration. And it was one house in the entire district that had broadband, so that whole district was accredited as having access to broadband. And we took that information when I was in the Energy and Commerce Committee. We had a hearing on it, and then that really led to an awareness that the mapping was wrong. And now the new FTC commissioner, or FEC commissioner, is very much aware of this, and there's an enormous bipartisan demand for getting these maps right. That's number one. But number two, there is more flexibility for us here at the local level because the resources have come back for broadband. And now, that implementation is really, really a hard, practical challenge, and it varies on how challenging it is depending on, whether you're in the Northeast Kingdom or what the geography is, or you're in Chittenden County. So, but we've got to stay on it. But my point here is that we do have to stay on it because we're in that implementation element. We're getting it done is really what's going to be the best. Being effective is what's going to be the best way to get support from the public, who is skeptical of the capacity of government policy to make much of a difference.
Other questions? Or now's our opportunity. It's wonderful that you're making yourself available to so many committees.
Not so many, just my favorite chairs.
Well, so many. And we know you have to want to respect your time as well. I assume you've got your remarks ready. Senator Welch is there having a small ceremony of Jim Morse's life at the Supreme Court at 2. And thanks.
I have a question.
So,
I'm wondering, you talked to the farm group. I know you was up in St. Albans a week or so ago. And I'm wondering, have you had any good news from the ag agency on the organic farmer
Relief.
Well, relief, which is very broad, and we don't know the way that's written, if it means farmer, sales, the co-op sales or the processor sales, and it really needs some clarification.
Right. And I know where we're at on that, and they're in the quote rulemaking element of it. So there's a program where there's some money that's available. And when I was down on the Course Farm, we were there.
Oh, yeah, that's right.
Yeah, a couple of weeks ago, one of the organic farmers asked the basic question: where's the money? We need help now.
Yeah.
so where is it?
It's the answer from the undersecretary was soon, but they have to go through the statutorily required rulemaking. And I pointed out when I saw that undersecretary back in DC, you remember the question was, where's the rule? The question was, where's the money? And, so I don't have the specific answer, but I've got the specific message from the farmers that time is of the essence, and whatever we're going to do has to be done now.
I think they kind of gave up on it, and they came and asked us for 9.2 million.
I saw that.
And you guys have got 100 in that bill, and it'd be nice if that was going to go to the farmer, that we knew that it would take a lot of pressure off from us. I mean, we know we need to fix the issue that's caused them not to be paid properly, because if you remember that if you buy 100 pounds of milk for $32 and you're getting $10 a gallon for that milk, you have $100 to start paying for the 32. So where's the other 68 going? We can figure that out and regulate that, but this initial shot of is pretty heavy.
All right, so we'll follow up, because that's a message we got from the farmers.
Yeah.
Same thing.
Because
Yeah, there's now, I understand that real pressure on you.
It
How
is.
can we
What's
help?
happening is, in the absence of the money coming on the federal level.
Right.
Pressure on the state.
Yeah. Jenny, you did it?
Well, no, I understand that Senator Sanders is probably more intricately involved with the healthcare environment right now. But first, I want to say thank you for standing by Medicare and Medicaid and Social Security. That's really important. One of the perennial questions that we have is with regard to the self-insured folks and how difficult it is in our state to make any progress toward equity and parity in terms of supporting our practitioners and having patients maintain access. So anything that you can do or any understanding that you might have around moving us more toward what Hawaii has, where they do have regulatory authority.
You talk about ERISA?
ERISA, right, the self-insured. Yeah, so the ERISA, the folks who we can't touch right now. I mean, it is a difficult situation. It gives us a very narrow amount of the
Right.
wedge in the
I mean,
pie.
but I don't know what Hawaii does.
They
have
were given forgiveness when it all started several years ago, but just to give us some level of authority to regulate self-insured plans in terms of, yeah. It's a huge question.
Well, it's an indication of how fragmented and therefore how incoherent our healthcare system is.
Absolutely.
You know, you've got Medicare, you've got Medicaid, and then you've got the employer-sponsored plans, all the arrests where there's no jurisdiction to deal with it. And then you have, and just to give an example of how that fragmentation hurts, we did something that was long overdue and really, really good, and that is $35 a month limit on insulin prescriptions, but we can only apply it to Medicare. All right, there's millions and millions of Americans who are paying $300 and $400 a month. They don't get the benefit of this law. And to some extent, it was the pushback in other sectors that stopped us from doing it. So the fragmentation of our healthcare system, I think, it's a chronic problem. And anytime you're trying to do some significant reforms, you've played a major role in, you run into those jurisdictional obstacles. You just don't have the authority to do something, no matter how beneficial it would be to the people you represent. And what I'm seeing with that as well is that it allows for a lot of the players in the healthcare system who are outside of any kind of regulatory control to be able essentially to price gouge. And of course, you see that with pharma enormously.
Yeah.
We saw it in this during COVID, where we had such a nursing shortage. The only way hospitals could get nurses with traveling nurses, and we're all really grateful for the traveling nurses. But those organizations that provided the traveling nurses were bought up by Wall Street hedge funds, and then they stuck it to
Now
all
they're
of us.
buying water.
Yeah, now they're buying water.
Exactly.
And there are public goods there that when you serve on a committee like this in the legislature, you're just really mindful that everybody in Vermont should have access to healthcare. We've got to have a system where it's affordable and realistic that can be provided. And the fragmentation of our healthcare system, I think, it creates this dynamic where there's a lot of points of entry for like the hedge fund profiteers with a lot of pricing power to stick it to us. That then becomes part of the overall cost of healthcare that bleeds into Medicare and Medicaid. And then the only way the government tries to control the cost is by then shorting and paying less than should be paid for Medicare and Medicaid in many cases. So that holistic approach is, that point you're making, I think makes a lot of sense if we're going to get to a place where we can have affordable and accessible and sustainable healthcare.
Glad you brought up the hedge fund issue.
The other Medicare related is the proliferation of Medicare Advantage plans.
Yes.
And we're in the negative impact.
I'm sorry.
Yeah, and so, I mean, obviously, I don't know what action Congress intends to take. There's all kinds of articles around, the practices of the insurers, and you have all this advertising and you have theoretical coverage, but it might be one visit or, 10 prior authorizations before you get it. But the other part is the provider community, and we're hearing from home health agencies that the reimbursement practices are really detrimental and sort of going to help destabilize that fragile delivery system even
Right.
more. So I just, does Congress, I'm just wondering where this is on your radar screen in terms of that decision to privatize, the way in which that market has been taken off, but the abuses and the cost, and to some extent, maybe putting Medicare in jeopardy because of the ballooning cost. So
Well,
I don't know, maybe we don't understand it correctly,
No,
but
see,
it's a real source.
well,
of
two
concern.
things. I mean, first of all, what you're hearing from Vermonters is how this is not working. Okay, it's been a very effective marketing program. It gives perhaps the illusion of choice. Maybe there is an element of choice, but you check beneath the hood and it's really having disruptive impacts with compensation for people who are providing the service, and then therefore that threatens the sustainability of service. And I know the Biden administration has been hearing the same thing, and they're now really, quote, investigating. But this is where there's going to be, again, a huge pushback from the insurance industry, where they found a way to get into the Medicare program that in some ways has real implications for the durability of Medicare. And of course, Medicare is profoundly important to citizens. So I actually think it makes sense to try to document, in a simple way how this is happening to Vermonters, because people are hearing about it anecdotally, but I've not seen yet some sort of comprehensive documented expression of how this is playing out. I mean, it might be a joke, but it's got to move beyond the anecdote into a somewhat documented practice, and then allows your committee to say this practice is going to kill us. And if we deal with it. Richard?
All you need to do is go and look at my home health agency's budget. And United Healthcare is a good payer, but paying rates 50% of everybody else. Blue Cross Blue Shield is holding their bills for months, and they're covering less things. And if you have an Advantage plan here for Blue Cross Blue Shield, you have to, and you're a provider, you have to call to Texas, to Austin, Texas, to try to get an answer on whether or not something is covered or not, and they won't answer the phone, and they won't even negotiate with our overall home health agencies collectively to talk about these rates. So
That's not real.
that's a pretty bleak picture from my point of view, and because of that, my home health agency is facing a couple $100,000 deficit immediately, and it brings on pressure from an administration here who now says, let's get rid of the provider tax on the home health agencies, but that's on the backside of all of that.
Right.
And what's going on.
And
So
that's
it's
terrifying.
being pushed in a
Well,
way
there's no
that is
control,
crazy.
and you've got the local home health agency that is connected to the lifeline for a lot of people, and they're getting nickels and dimes, and they have no
Sorry, that
control.
was more than, but
No,
I hear it every
that's
day.
the heart of it. I mean, we need more primary direct service care.
And
And
this, it seems to be working counter to that. You talk to physicians, I mean, they're saying, because so much time on prior authorization requests and denied services and arguing why things should be covered. So it's very pervasive and sometimes kind of insidious and sometimes hard to see
Yeah.
in totality what are the impacts of this move and expansion. It's got to be tons of money when you see all the TV ads. It's just
well,
incredible.
I mean, look, we all know we spend the most and get the least, all right?
Yeah, we do.
I mean, that
We buy high,
that's
sell
not how
low.
it keeps going along, but I think the biggest threat to access is cost. And the cost of healthcare is just not affordable and sustainable. And
But how long have we been having this discussion? The cost of healthcare. You know, I think, you know, my father-in-law started the hospital data council back in what, like 30, 40 years ago. Yeah, no, it was before, yeah, it was a long time ago. So, yeah, we talk about it, and yet the solution seems so elusive. We keep working, we haven't given up, and what the impact is. But
Well, you know,
then to have a major pay.
it's frustrating, obviously, because you know it needs a systemic approach. And the players that are in the healthcare system, players is the wrong word, but the folks involved, the folks who are providing, the direct service providers are the ones that are getting squeezed the most. So just think of what our nurses went through, our home health agencies, what they went through with COVID, where they were on the front line. They had to contend with all the same things that we had to do with kids or grandkids, and working and educating your child, but then they had to show up and be exposed more directly than any of us to the threat of COVID. And then, you know, the pharma companies did incredibly well. And that vaccine now cost them.
You know, I think your staff are getting nervous. I just want you to know.
No, we'll go. But, you know,
It's in back.
just on the note of something good, we finally got prescription drug price negotiation in a watered down form compared to what we want. But what we did, it's the first time we've been able to beat pharma. Okay, we got price negotiation. It's limited, but as I said to the horror of the Wall Street Journal, the slippery slope is a powerful tool to begin.
I thought you were gonna say the camel's nose in the tent.
Well, I like to say this.
You're on your way.
Well, I know that your staff want to make sure it's 20 up to, and you do need to.
No, we're okay.
Okay, well, we
You
You don't
certainly,
have far to go.
Will you not hold up the judges?
no.
Well, Jim Morris was
You get stopped.
very,
20
very good friend, but very instrumental in getting started here. Come on, he was the Defender General. I was the first class of public defenders. And then,
You better get there.
Well, Jim Morris was clerked with Terry Waterman
Right.
in St. J.
right,
And he actually, he and Gretchen rented the apartment for my brother-in-law. So I knew them way back.
wow.
Back in what, that would be
Never want to
about late
forget.
60s, early 70s.
Yeah.
So
Man.
I know that it's great that you're going over.
It's good to see you guys
Yeah, well, it's nice.
Twice in a day.
Thank you for being here.
Twice in a day.
hanging out.
Well, you've been hanging
Transportation,
out.
I stopped by to get my muffin top from Senator.
Down in Eggs, all we have is sour milk, so that's.
All right, well, it's good to see everybody.
Well, enjoy it here. And you'll be heading back to
What's
Washington.
going on down there? Can you still get down there?
No,
Yeah.
no, you know, the fun days are over. Peter.
Go down there?
No, I remember when,
So basically.
Yeah.
Maybe your mates go down there.
Edgar May,
That
Edgar
was
Go
May,
down there and you had some fine French wine that you wouldn't let.
Edgar May would sit here and he would ask you a question. And then before you could answer, he'd get up and go downstairs. Responding, but he had gone, and those were the good old days.
It took the door handle right off the door, so we wouldn't go down there any.
Well, the door's gone.
The door
door's
handle is in
gone.
her drawer. Yeah.
Yeah. Oh, well, life is not what it used to be.
All right.
Thanks, Peter. Good seeing you.
Good to
Thank
see
you.
everybody.
Yeah.
Take care.
Yeah.
Bye-bye.
Good luck.
Bye-bye.
Yeah.
How are you?
Take care of the nation.
All right. I hate to say it, but we're gonna work a little bit more on the budget adjustment. And until 2:30, and then we're gonna adjourn for the week, and then some of us have got some other calls or meetings scheduled. So Stephanie, do you remember where we left off?
I will find it.
Okay.
We were near the end of the one.
Are we down to section 48?
Yes, that's where we ended.
Okay. because I had okay in terms of what we were doing to deal with those modernization expenditures.
I thought we stopped at 54.
Okay,
Well,
so,
did we? Yep.
no, we did do 48.
How many 26?
We did do 50.
I'm gonna keep going.
Yeah, you moved up to 54. Yeah,
No,
sure
we-
did.
We actually made it through human services.
Yeah.
So I guess we,
And we did, we stopped at global commitment
yeah, okay.
on page 23. You are absolutely right. Too many.
On 23?
On page 23,
Yeah.
I have a mark there, so I just didn't have. So, let's keep going.
Mr. Wolcott and,
So section 54,
We're
these
gonna
are,
have to change, right? Or no?
yeah, so these are really housekeeping. These are the certified amounts. They don't run through the appropriations part of the budget, but we like to understand what they
Well, wait a
are.
minute. We've done this because I've annotated room and board on
Oh,
section
yeah,
56.
36.
And I
Okay.
believe we are now
I was
on
right.
page 26, education recovery, and is that where you have us?
Yeah,
Senator
we were
Maloney?
gonna stop there, then we
You have
slipped
us
in
on
like
page
2 more
26.
pages.
Oh,
and-
I did, pushed you.
I think we are 26.
We are 26, okay.
Nice.
Education
fault.
recovery
I'm
and
excited to get
revitalization.
Yes, yeah.
We'll be redundant.
I was
Sorry about that.
We'd do a couple that we'd already done, to see if we still changed the same.
Or was it test?
So, okay, so we're,
I'm sad.
Uh-huh.
Right.
That might be the propane.
no, it's a scam. It's, oh, yeah,
It's
so that's
always
right, on
broken.
Friday, my tenant had no heat, but no, that's not,
It's warm enough today.
let him, right, let him.
So section 57.
Oh, yes, this is.
This is also housekeeping mostly. With bringing the references and. the
Oh, to make
data.
sure that they have enough money, so at the end they can move it around, so we spend every dollar. And we thought that was a good idea.
Well, this is the flexibility
Yeah.
section.
Yes,
As long as they don't unfund what we fund.
I know, I
Yeah.
think,
Can't believe it's still-
and then,
Yeah, we do want to make sure we spend all of it though.
so section 58,
Section 58, this is, you saw back in the teacher's retirement, in the B appropriation section, the add of the $800,000. This is just reflecting it in the language, the change, the two pieces, the normal cost and unfunded liability, general fund piece. Page 27, what's a new section 59? This is, we went through this in the C section of the governor's FY24 budget. This is just cleaning up the Vermont Life.
so this is I mean, Rich and I are not gonna have to experience anything again, this chapter has been closed.
You will be repealing.
You don't seem to believe it.
I can't believe it. And I just wish you'd been able to sell the name, if we're just gonna use it.
So, I think,
Takes the reference to it out of statute. and
Yep.
repeals it.
Kills it completely.
Well, quick question.
What?
If this kills it completely, could someone start an online magazine tomorrow or the day after this that's called Vermont Life?
I don't know, that's a legal question. I have no idea whether we still retain sort of ownership of,
It's still there.
it's like a domain, do we own it? But in terms of our budget and finances, this is closing out the books. Goodbye, it's a sad day.
It's taken so long.
Now, I see this is why Chris is here. We're getting into just the transportation changes.
Sections 61 through.
That I think we went through this. It's just, this is just the language that goes with the discussion we had the other day. And it's to, you know, in terms of how we treat the reversions relative to the stabilization fund, and then I guess that's all this is related to the stabilization reserves.
Yeah, these are across 2 years, and so the one that's in section 62 right now will need to have an effective date, retroactive regarding it, so.
Okay. So I think we were in agreement that we didn't want to make reversion subject to that stabilization 5%. So now we're down to section 63, and this is brownfields.
This is the carve out of the $1 million of the brownfield appropriations where the RPCs.
And to me, this is indicative of the importance of legislative intent, because we did have in prior appropriations money to go for the RPCs to do the assessment for brownfields. The funding that is the subject here was appropriated in the House passed budget, and we kept it here, and there was no carve out for the RPCs. So the RPCs came forward and said, well, where's our money like we had before? And we didn't have the language, but we had the chair and vice chair of economic development sending off letters that it was their intent to do it. Well, it might have been their intent, or maybe retroactive intent, but this is an example of really the importance of making sure we're clear on intent, or the real problem is when people after the fact sort of are issuing their view of intent. So now we're getting the RPCs their money. So I just want to remind us around, and that's why we do a statement of a letter of legislative intent on the budget to try to address any areas that there might be questions on. It's not totally perfect, but it really is important because sometimes people want to revise or their intent gets defined by their own desires or.
How's that money getting divided up? Do you know?
Well, they select one and then it's the same method that they've used before when we moved the brownfields money out. So one entity gets it, and just like they say, shall select one regional planning to administer the funds. And then the selected shall subgrant to the other regional. It's right up here at the top of page 30. So it's the same process that we've used in the past.
We've done other.
But when we did the brownfield appropriation, we didn't have any provision for any of that money to go to the RPCs. This is now allowing that $1 million to flow to the RPCs to support the work the same way we have done it in the past. So they'd be very happy. They'd be very unhappy if we didn't concur with this. So I'm gonna see if there's one group that we could make less unhappy and close it out. Because I'm sure there are others that might not be happy. 64.
This is basically another piece of housekeeping. The $95 million that went to the broadband and was from the capital ARPA money. We can't commingle it into the special fund. We have to account for the ARPA. So that's what you, same use. It's just, it was drafted as transferred into their special fund. We can't do that. And that's the change you're seeing there.
Shall be used, and we're getting rid of the transfer of the broadband. All right, this is truly a technical. We can't commingle.
In section 65, the use of funds by efficiency Vermont, we have to obligate them. And you have to make a change here on the date. The date here needs to be changed to 2026 instead of 2024.
Yeah, that was one of the requests that we had, right?
Yes.
Stephanie, can you just quickly, it says clarifying misinterpretation of intent, but how do you read use versus obligation?
So it's kind of, these are ARPA dollars, and so we have to have them obligated by a certain date as opposed to actually out the door.
Okay.
For 24 days, it's our obligation to 26.
However, the request that we have from Public Service Department is to restore the word use. And obviously make the date change, but we have, and so the Public Service request is to strike obligation and restore use and change the date to 2026. I don't think the date changes in the issue. This would allow Efficiency Vermont to have until the Treasury deadline of 2026 to spend the 30. But I don't know, Public Service will still be required to obligate the funds to Efficiency Vermont by 2024. So I guess obligate isn't necessary because they would have obligated it by 2024, and we've already got the Efficiency Vermont available for their use through 2026. So that's the request to just restore use
And to change the date.
and to change the date.
The 30, the 35.
So it's
million.
Efficiency Vermont that has to use the money, and public service has to make sure it's obligated by the date required.
So we're not doing what's. We're
No,
doing-
you're undoing you will not have the amendment that changes use to obligation. That will, the use will, the underlying language.
But we will change the date to December 31st, 2026. Okay. And provides clarification by substituting. So we are
We're
going back. All right, shall we move to, I'm going to move to section 66. And what do we do?
I think we
Reverse
transpose
the numbers?
I think we transpose numbers there in the draft.
Where are they at?
It says 32.
23 to 32.
We
So we
typed in
just-
23, but we should have
I
typed in.
get that. I just wondered where.
Oh, this is in positions created for the ARPA, their limited service ARPA positions. I believe is what
In much.
in the bill last year in section G
They
800.
were just in general for all different agencies.
Yes, there's a list in that G 800 section. After A, there's a
Long
1, 2,
list.
3, 4, by department,
Okay.
by title.
So this is just to correct the number of positions referenced in that section. Okay. Well, 67, that is truly a technical. One-time positions, not transfer. So you can see,
Yeah.
one-time funding to support for 2 years, made permanent within the JFO and base funding. So
We should have caught it last year and eliminated this transfer because we didn't need it. But
So we didn't need it because we've already dealt with making position permanent. So
And
let's,
after section 67, on that same request from public service, the $2 million workforce, they're requesting a date change as well. And so you will be adding a new section in your bill after 67 to amend Act 74 regarding $2 million of workforce money that was appropriated 2 years ago from ARPA.
this is the request. Public Service is also asking to extend the statutory deadline for FY 2022 $2 million appropriation for workforce development that was passed by Act 74 H 439 last session. Again, the field report I have is that these funds are flowing, but are not expected to be fully expended by the end of 2023. Therefore, this is a technical fix asking that the date we add the 2 million and
They're simply amending, pushing out the date.
and the date would be moved from 2023 to 2024. Is that all
We
right?
don't have until 26 to spend that money.
So we put in the language that went with this $2 million in Act 74, we put in a specific date and they won't meet that date. And so for this workforce development.
And it was specifically to support the expansion of Naval Works and the Heat Squad program. So I think what they're feeling is the money would be expended. They don't need till 20.
They're not gonna make the date we put in session law.
Bobby's asking,
Yes,
well,
we should give them-
others, should we give them more time? But they're not asking for more time at this point. They asked for more than the year update.
So we
So,
always do it again.
yeah, if they don't have the money out the door, but I suspect they will by then. So that goes in. That where does that go?
It'll probably go between 67 and 68.
Okay, so we'll add the language about workforce. All right. Moving right along here, 68.
68 is a change in the legislative IT reversion relating to the 22 reversion, but this one's retroactive as well. We just didn't catch up this number last year, we should have, so that the 120 is what was reversed from Ledge IT. And the sergeant at arms piece
Okay,
was,
so-
so it moved, the 120 was the total that got reverted from the legislature, but it was split between two sections. The 100, no, that's not right. So we ended up 180. We must have changed the number along the way.
Well, see, technical correction.
So the 120 should be 180?
No, 120 is correct. It should have moved to 120. And the sergeant at arms should have been at 60, but we put that in the intent document after we passed 74, but we didn't actually catch up the language. We should have done this in the budget adjustment last year, and we didn't catch it.
Well, who caught it now?
Closing out FY22 caught it,
Oh,
and now we are retroactively saying that's okay. You did what we intended you to do. Is what we're saying with this.
I think we did what we intended to, okay.
We're blessing it after the fact.
All right. All right, 69,
69.
investments in Vermont's economy, workforce, and community. This is the G section.
Yes.
This is ARPA.
This is a $3 change, it looks like. No. So it looks like.
Yes,
It looks like a $3 change.
we saved $3.
Does we got them?
I'm not sure why the rest of it is underlined though. It feels like only the numbers should be underlined, and not the rest of the words.
And reconcile the subsection totals. I don't know, but for $3?
Somebody bought a coffee.
Or return
So
to.
It's a technical
They
adjustment.
thought they were gonna buy
It is something.
That's $3, huh? All right, section 70.
Capital,
I don't understand, we put the before the dot and then that.
It's actually the underlined language that is being, I mean, the red is simply what the House did,
Mhm.
but the underlined language is the amendment as proposed initially. The red is just the sort of further technical edits from the House.
Okay, so they're, for home health agencies, this is what they're changing them. The total grant amount shall be calculated at.
Yeah, the home health agencies. I think this follows up from what you approved in joint fiscal regarding these funds when you came forward and asked for
More money.
Yeah.
So you think this is to reflect these?
It's the premium pay piece that we did last year in the budget adjustment. Necessary to expend a portion of the remaining premium pay funds on a 50% increase in grants to home health agencies. And so you were able to approve a portion of their proposal in joint fiscal, but you weren't comfortable in joint fiscal. It needed to be done in the law, in the budget adjustment to do the 50% piece. You didn't feel like the language around this allowed joint fiscal to do it. Although it's the same plan that was presented back in November, December.
At our joint fiscal meeting.
Yeah.
So this is in here to sort of make official what we wanted to do, but then we had the joint fiscal didn't have the authority to do.
And also on the bottom of page 34 and 35 was the preceptor part of the plan. Actually putting that in as an allowed use of the money that's remaining.
I guess what I'm struggling with here, Stephanie, is this is what,
So we did the 60.
who dreamt this, I mean, this language, in other words, we, at joint fiscal, we deferred action of,
You allow them to take one action, which was within the parameters of the underlying language. We'll have the-
my question is the language that we're being asked to approve here, I guess the House must have looked at it carefully,
Yes.
is the administration's proposing to,
Of that $60 million pot of money for premium pay, there was remaining money. And
we expanded the number of occupations.
yes, and then they had a proposal to do these two other things with the remaining money, but
We said we didn't, okay.
you didn't have the authority at joint fiscal to say go forward and do that. And that's why they're here in budget adjustment. This would give them the authority to use the remaining money in that $60 million pot in these two ways. The $3,000 full-time equivalent on the home health, and then the preceptor piece that you see on 34 and 35.
And then,
This is like everybody.
Stephanie, I'm wondering on 35 at the bottom of B, it lists 4 different streams of money and it says through a combination of these, tuition and fees shall be covered in full. That's very clear. Then it says, and trainees shall be provided with assistance in meeting their living costs, such as housing and childcare while attending. So there's a shall be provided with assistance, but then it's completely vague what that means. It says such as, but if I'm reading it right, it says they shall be provided, but they could be provided with little or nothing or everything or anything in between.
I mean, it seems like, well, that's what I'm kind of struggling with, this language that obviously that was developed by the administration.
Yes.
And the agency. This is, I think we're kind of like, where did this come from? It hasn't really been looked at, other than the joint fiscal saying, it seems like a good idea, but we don't think we don't feel we have the authority. So it's now coming here. But, what does it mean to say, the tuition and fees shall be covered in full and trainees will, shall be provided with assistance in meeting living costs such as housing, childcare while in the program? I don't know.
So it's,
Was that our language? at
no,
some
this
point?
is, no, this is all new language. The underlying language is new. And what, it's starting at sub 2 and 34, it says, and did A and B are the two things they can use the remaining money for in that pot of $60 million that you put in the budget adjustment last year. And A is the incentive grants for preceptors, and B is if there's money after the preceptor, the grants to healthcare providers, long-term, special for established and expand partnerships with nursing schools. So it's this, what I think you're seeing here is that we have
It's a waterfall, I
Yeah.
can see.
You have a combination of all the very scholarship money for the nurses.
I think it's what I'm concerned about is in that waterfall.
Yeah.
How we can say you shall, in other words, it's a limited pot of money, but saying you shall meet tuition and fees in full and trainees will be provided assistance and they shall be provided assistance in meeting their living costs.
So it's probably clunkily drafted. So you're, these are grants to healthcare providers, and after all the scholarship money, the first is making sure that the whole cost of tuition is paid for. So you could use this grant if there's still a gap, and then any remaining for the assistance. And I think that's what's not clear. What you're pointing out is not very clearly drafted.
No, it's one thing to say you shall, the money shall be used for this, but to suggest that we have an obligation to meet something in full
Yeah.
or
Yeah.
of what that level of assistance we might be obligating under the grant. It seems a little unclear. It's pretty expansive.
Yeah.
They shall be covered in full. I mean, it's sort of like all shall be winners and all shall have prizes.
And I think what they're trying to say here is we're gonna cover the tuition fully first with any money. And then if there's more money, we will do the assistance piece. And that's what's, yeah.
Yeah, that's,
But,
that makes sense, but the way it's worded,
but it's not even a waterfall, because in a waterfall, the last water doesn't have a shall on it. It's
Yeah.
I know.
Yeah.
So the shall conveys an obligation, and I don't think that's what we need to have a rewrite. Yes,
So
Jenny?
when you're also looking at this, I'm trying to sort out how this is all coming over, going over the.
Maggie provided.
So it says through a combination of scholarship awards, grants awarded to the healthcare employers.
allow it.
So is he going to the employers? Is that, am I reading this accurately? Going to the employers and the employers are distributing it to the trainees.
Mhm.
And so there must be criteria that they're using to make that happen so that they know how much tuition they can cover in full. Then it goes on to that question that you just asked. So what, is there anything in place currently? I'm not sure what we're doing overall.
Can you change that to shall?
I think we need to
Yeah.
just hold that so we understand.
I think the gist of what they're trying to say is this pot of money that's left over in combination with all the other, first is gonna.
Can be used for grants.
For grants.
Yeah.
Through the employer to make sure first the tuition is fully covered. And then the assistance afterward, but that's what we want to make clear in the way this is drafted.
Maybe provided.
So it's-
Depending on, a funding.
I think that the shall is a way of saying, it's just constructed funding, it's about tuition is the shall. That was their way of identifying the tuition covered first. Yeah.
Well, so that makes sense. That's the way. I
If you
think
go
we're
up to
struggling
the
with.
top, then you've got grants to all the employers, the hospitals, FQHCs, and then nursing schools, or both to train members for LPNs, LNAs, and higher level, to become higher level. Then it goes on to the employers, so I'm trying to figure out. It's the employer equivalent of the school, so that there's a lot in that paragraph.
I know, I think we need to. And I think we,
And commas wouldn't hurt.
Or stacking it in a way that you follow the flow.
I know. Yes, I think we're all struggling with, what is this?
I want to know what the intent is.
All right, so we're gonna hold that and hopefully we can get something that's a little clearer. Since the administering entity wrote it, I'm sure they know what they had in mind, but it's not really clear to us. Now, section 71.
Well, I think this is clarifying what we just talked.
No, this is a new, amendment proposed in the House, particularly the House Commerce Committee, regarding the $400,000 specific nurse preceptor appropriation, where they are specifying what you can do with any remaining funds, an initial grant opportunity.
To how every hospitals.
So the agency may open the grant opportunity, so after the first round of opening to other healthcare employers, including.
All right, so not all hospitals are critical access, so it would open it up to them.
Yeah.
And then others would be healthcare.
A lot of money for
Designated.
Non-critical, long-term care.
Give it to one sector.
Opens it up pretty wide.
So I think the question is, because it is still specific to the preceptors.
Yes, yeah, so it depends on what space they have for clinical treat education.
Well, and that's always a
Always
challenge of finding
worthwhile.
placements, so I think opening it up probably, I suspect what they're finding is they're not getting the take up at the level they would like.
And there's nothing in here about utilizing telemedicine or remote learning, because they can expand their access by doing that. They have, there's nothing there.
If we're
I started suggesting
100,000,
they do that last year, but I don't know whether they're doing it.
if 400,000, it's not very
It's not a
much.
whole heck of a lot.
So, but I would suspect that somebody is saying this hasn't had a very good take-up rate to
Yeah.
be putting this in. Otherwise, if you had pretty much expended your 400,000, this would not be
Okay.
necessary. So I guess we should give them, you know, expanded opportunity, because we certainly finding preceptors is a challenge. So, and 72, manufactured home improvement.
And the only change here is the reference to the source of funding. This was S11, section S11, just like 400,000. It just is the reference to the American Rescue Plan.
Okay, so that's certainly technical. 73,
73 is
okay, it was a carve out and not an additional appropriation.
Yeah.
Okay.
that was the intent all along, it was just making that clear, I think it drafted quite clearly. $74. This is the $15 million out of the ed fund to VHCB for the revolving loan, and it's notwithstanding because it's an unusual use of ed fund dollars that's being added. So the intent pickup that the notwithstanding was missing, so it's included here. There is actually another notwithstanding that
Probably is.
that on ed fund dollars, that's that PCB.
They're using it
So-
on the educational.
So there's an amendment to also notwithstand with that reserve so that it gets used. And I think that here as well.
When do the rules come back for accessing that money?
So we allowed a certain joint fiscal allowed or emergency board, I can't remember which now, I think emergency board allowed a small, a
Yeah.
portion of it to be used.
But then there was, A&R was
No.
supposed to come back with rules, weren't they?
I think we ended up releasing it all.
Did you resolve it? Yeah, okay.
I think we did. And, because they did come back with their proposal about how the full amount would be.
To the
used.
e-board.
Yes.
I see. So you mean they've released it?
Don't you remember, because we had the cap, and then they came back with a plan, and I think we released it all.
And making sure that what they wanted to do was state by certain
Upfront
ability,
equipment and stuff.
equipment and paint and things like that.
So
But
I believe we released it all because they had a plan in terms of how they would use the funds.
This was tech ed.
No,
This was the PCD.
I thought we only released, of the 32 million, I thought we only released 2 million.
That's, my memory was that there was.
I mean, I don't think you, I think we're waiting for the
Oh.
results of the,
oh, we did,
activity.
but I thought the amount that was,
of the amount that could be released, you did
Yes.
release all of it, yes, I'm sorry.
Yeah, the interim money you were.
right, yes.
Yeah, I'm talking about
Oh,
the
you're
rules
talking about,
for the remaining.
oh, I don't know about that. I only know that we were saying, because the cabin school was the first application on that. And so they came with a plan where we did
Yes, so the-
release that.
Yeah.
And I don't remember, how much was that?
2, no, so the whole reserve, I think, was 32 something, and I think you did 2 or 2.5.
It wasn't,
We could look at the e-board minutes and get that.
it wasn't a lot of money.
No,
Do they come back to approach? Who do they?
so I think I don't know when the first round of the full picture comes forward, but we'll find out, we'll get
Okay,
we can open.
yeah, I'd appreciate that.
It is, yeah. The yield bill last year, which is Act 178, I don't know if we end up with the tax results.
Well,
It's
I don't-
spelled out.
Yeah, we can look it up and,
Yeah.
get you the answer, but this is the notwithstanding to allow.
So this is the 15 million to VHCB, but we need to add notwithstanding
Yeah, okay.
around the
To allow the
PCB.
use.
Yeah, the PCB reserve.
And
to
I
be
don't think
used.
this has gotten off the ground, but that's a different issue.
I think that I did talk with them, they said they're making, because these are loans, right? If I remember correctly.
So we're setting up a revolving loan fund.
So they're not gonna do the loans at VHCB, so they're working with an MOU with like the bond bank or something. They've been doing, that's what they've been working with.
All right,
But
but
it involved, the loans were to the CTEs or to the developer. There was a little unclarity about how the money would flow from, to how the CTE piece would tie in.
all right, but then we do need to notwithstanding to allow the money to be used, once this gets set up. So 75. What do we have here? Oh, technical correction to ensure appropriations are correctly categorized as one-time in nature and not added. Seems like they weren't very, because we moved that one-time expenditure out of base and onto one-time, and it seems like.
I'll just say that S11 was challenging because it did not come into this committee as last year, really. It's not on the floor for the most part before it went to conference.
So just, this one came out of Congress, Michael Soraka.
Imagine that they mush the economic development and workforce together.
Final craziness.
It was, yeah. All right, so this is just technical correction, so.
Yeah, it's, we're referencing the Global Commitment Program.
Okay. So 76.
76 is. This is also a piece in S11. This was, I believe, in the interior. This has, these are the community grants that this, or the forgivable loans, I can't remember which, one of the programs. they found.
Ensures maximum loan amount options are consistent with eligibility criteria. Subsection.
So it's the other, the setup allowed this other appropriate basis of comparison. And then we also have to sort of tie back and make sure it's consistent. I believe that was part of the intent document as well. You'll find it in the intent document. Speaking with in the spring, when this first came up as an issue that needs to be included.
Apply retroactively.
And then
But I don't, how do you apply retroactively to applications that were received on or after that date? What if you've already received them and approved them? This is something the House added.
Yep.
Can we understand this better?
okay, I'll pull. I didn't pull the intent document down. I should have done.
Well, it's something the House added.
Yeah.
And shall take effect July of 2022 and apply retroactively to applications received on or after that date. And that's fine if applications are open, but if they've been processed, I don't know. Maybe this language ensures what they did relative to maximum loans. We're just trying to.
So the notwithstanding is what the piece in underlined in black was the piece from the intent document. We'll understand. I'll get from Maria why this probably was a recommendation from the Commerce Committee for some reason. It's been read.
Well, I'm gonna keep it open. And we'll keep going, because otherwise we're just gonna sit here and try to second guess what it's all about.
With 77 is we just needed to update the date of the reversion of the older, past 2 years ago, economic development money that didn't get out the door. We need to
scooped it, reused it.
Yeah, but we need to update the number to the exact number that can be reverted, which is the $42,000 instead of the $25,500 that we used last year. And we're reverting it this year. We weren't reverting it before June last year, so we need to update the date.
All right, now we're,
We heard from ACCD on the downtown tax credit. I did,
so the house change,
so the House changed what was initially recommended by the administration. I've
so
taken
it's in
another.
red and all struck out.
Yeah,
So did they rewrite it once and didn't like it and then?
so they struck out what, it was all struck out was what the governor sent over. And then what's in red in section 78, what's struck 31 was what the governor sent over. What's in section 78 is what Ways and Means came up with. And then I have an alternative, which is clearer, because this is a mix of underlying base capacity annually of $3 million and 2.45
Oh, it's the one time.
one time. And I did go over it with Commissioner Hanford the other day. And the only thing he's not clear on is we thought this was all for 2 years by the end of 2024. And he's fine with this redrafted language, except he might change it to either 2.5 or 3 years. He's not positive he can get it all out the door even by the end of 24. I will follow up with him and find out, what date. But what this is meant to do is to make clear the potential amendment at the top, that the 2.45 is the one-time cumulative addition to the tax credit capacity over whatever time period we land on, whether that's 2 years, which is what we were thinking and what the House was thinking, or this update from Josh that it may be a little bit longer than 2 years. We can, right now it's drafted as 2 years, but this structure makes the one time clear and doesn't mix the baseline.
Yeah, because we were very concerned about that. Tax credits, unless you make them time limited, actually are ongoing revenue losses. And they come right off the top in building a budget.
So he does plan to issue some this year, and the way it was drafted out of Ways and Means meant that they might be higher than the one-time application. So.
All right, so we're holding that until we get up. Does it have to be 2, 2.5,
or
3? I don't know. But it's still all within the money.
The only
that we
supplemental
appropriate.
amount, whatever period of time, is the 2.445.
All right. So that's something that's really important. It was very important to us to make it clear that these tax credits were not an ongoing obligation, that we had some one-time money and we were making them for a fixed period. So I think I would say we need to make sure we're clear on what is that one time and not conflate it with the base. And if it takes a little bit more time, that's fine. But so
To actually issue it.
yeah. So is people comfortable with that, except for making giving more time possibly? All right, so
You're at replace your ride and e-bikes now.
and this, okay, let's, this is what we've already talked about in terms of the money, and that was moving 100,000 from replace your ride to e-bike incentives, because the take-up was so much higher and there was money that was not being expended in a $3 million replace your ride. So this is a one-time move of that money over to e-bike, and we already talked about it.
Goes where?
It goes from replace your ride, the 3 million there, which is the take-up has been slow. So there's money there, and it's reducing the 3 million by 100 million down to the 2.9. And then the 100,000 reduction is being moved over to fund more e-bike incentives because the take-up in that program has been higher.
They used all their funds, so they wanted to be able to keep it going to the end of the fiscal year. Replace your ride, it's not that they don't have a slow up, they really have it going.
Well, that's true.
And they also can do e-bikes, so it's kind of taking e-bike.
How come you haven't replaced?
How do you get a percentage for your e-bike?
Well, you can right now because the program ran out of money, but as soon as you pass this, you could get
But there's
You
an
go to a
income
bike
test
shop.
for you, I
Yeah.
think, that might just.
If you're poor enough, you can.
If I put my legislative salary up, I'm sure.
So, and this is reviewed by transportation, and so this is, just moving $100,000 over to fund the incentives where there has been, where the money has been totally spent. And then,
Only like 20 minutes somewhere. He's got 20 minutes.
82 and 83 are technical. That was the disability bill last year. And it, when it came out of this committee, it was correct. It said allocated and had the right reference. And then in conference, somehow it went back. And so it's just making sure that it's enough. We didn't want to appropriate money twice. So that's why we have to reference in that bill allocated and where the actual appropriation is. And that's all that's happening in 82 and 83. And then I think you can stop here because 84 is starting to get complicated and that's probably a good place to
you know,
start.
I agree, and not only that, it's 2:30, and so we do need to, so we'll stop on page 43.
I'm putting a note, stop here.
Yeah, page 44, it's section
It's on
84. I
page
think it's-
44, I'm gonna sorry, 84.
Let's do movements here.
Loan repayment. Okay, page 44.
So that's done.
84 on 44.
Force, don't be forced now.
You got small, and I got stuff.
I'm going to say that we've kind of
Yeah.
come to the end of our energy level, and I'm going to stop on section 84 on page 44 and adjourn the committee for the week, and we'll continue our work on Tuesday. And we'll try to make sure that we're incorporating all the requested changes and modifications here.